Today is, what do we say? It is a wonderful day today because we had been planning to have this a medical health checkup, free medical health checkup for a long time. But the lockdown came and we couldn't do anything. And not only that, we have not been able to gather medicines also because, even the NHM, who normally give out so many medications, they say that it's only for the districts and they could not spare us, and so spare any of the medicines for us. So today, we've been planning for some time, and so I reached out to Urban Health Center, to Dr. Bilva, and she was very happy to come because this is her jurisdiction, and so she said she'll be very happy to come and help us out in this. So she brought her whole team, the nurses, the laboratory technicians, and the pharmacist. And so we are very happy. And then when she's brought all her laboratory, so she's able to screen all the Hep B, Hep Cs, as well as HIV also. Okay, and then do all the blood, what we call blood profiles, like HB, WBC, all that. So that people know exactly where they are. And then there's going to be a free blood pressure checkup, sugar test, all those things are blood sugar test. That is going to happen. And so this is organized by our drop-in center, Kripa Outreach Drop-in Center, it's called. All right. And this is so that we can create an enabling environment for our clients, especially those who are accessing our services. And who are those? Those are the ones who come here for not only medical checkup, for abscess dressing. When they start injecting drugs, they develop huge abscesses. You can have a look at some of the pictures on the wall, and they need our help. And so we do not, although it is a ministry funded, we do not have a lot of funds for dressing materials, for medicines and things like that. And so we would run from pillar to post, as it were, begging for free bandages, free dressing materials, and then and also, so that we can also give them not necessarily painkillers, but then antibiotics if they need. Because some of them, they come down with cold and cough and things like that. Okay. So as I said, this is a wonderful day, and we are so happy because of after the COVID, we are more liberated now. Okay. Liberated in a sense, we are free to call people. People can come and access our services. We have a counselor who does counseling to our clients who come to access oral substitution therapy. And we are so happy that these who comes to access our oral substitution therapy, they are all working. Okay, all working in a sense, which means their mind is free, they are responsible. Majority of them are drivers. Okay, you'll be happy to know. And they travel a lot. And just the other day, one of our clients, he didn't have time to come and access his OSD, the medicine. And so apparently he was taking his boss home. And he told his boss, he stopped the vehicle and said, "Boss, sir, just for a minute, I need to pick up something." And so he just ran across and picked it up. And so I told him, just be open with him and say that, that this has helped you, to stay sober and be able to function properly as a normal human being, And so that's what we tell. And so when they come for counseling, what we normally ask is, are you taking only this, or are you mixing with other medications, It can be alcohol, or it can be other, painkillers, as it were. And, very often they would say, no, we have not mixed. But some of them would say, I've drank alcohol and used other drugs, and so sometimes I find it difficult. So we'll tell them the ill effects of alcohol. It's like an educating them. So if you continue to do this, your liver will pack up. And with that, so many other organs will be affected, So if you can, slowly, we are not asking you to stop immediately, but if you can slowly give it up, reduce it, gradually and then give it up finally. So that you don't have to spend money on these, because whatever alcohol they're getting is all spurious alcohol, which is very toxic to the liver. So that's one of them. And then also on health issues. Okay, on health issues, as it were, if they are having, say somebody was not able to eat properly after he stopped his medications, his drug use. And although he's on OSD, he said, I'm not able to sleep properly, I'm not able to eat properly. And so that's when we are able to prescribe. Whatever we have, we'll give it to them, but we are able to prescribe. But we are very careful in prescribing medications because we don't want to get, they're stopping one and getting hooked on another. And so we are very careful in talking to them about it, making them aware. And I think they like coming here because we don't have a lot of recreational facilities, but we have a carom board. So they come and spend some time, playing carom board. And so, we also, as staff also, we are going to enter competition. and apart from that, we are happy that the government has woken up finally. The school, in the schools, the government realized that in order to prevent children going into using drugs, they needed teacher counselors. And so these trainee teacher counselor, they have spent about 2 months here in our drop-in center. So they are able to see what we are doing, and also they are able to interact with our clients who come. And so that's what they did. And now I'm not sure whether they've completed their course, but it was supposed to have been a 10-month course. But they were trying to ask the government to extend it for a year. And we do primary prevention in school, as I've already mentioned, and also in the community. One of the teacher counselors who came and said, she said, Madam, there are so many children who are into ganja. It's a soft drug, right? But it is easily available. And then she said, and some of them are even peddling. And these children are caught by the undergrounds who had handed them over to the police. Underground people have beaten them up and handed them over to the police. All right. And so that is not the way to treat our drug users. All right. We have to create an enabling environment, a friendly environment where we should provide them with support, right? Provide them with support saying that we can help you, if you want to access. If you want to access our service, we can help you. That is the way forward. Beating up is not going to solve the problem because we have learned from our experience in the past that the underground people will threaten the drug users. They would make them dig their graves, right? And then shoot them dead, all that, or put locks in their ears, right? And exact fine. And who pays the fine? It's not the user. It's the parents who pays the fine. And so they penalize the parents as well. And so it is very sad the way we had not understood how to handle drug users. But we are grateful to Kripa, who had come to Nagaland, and they had helped us to provide treatment for our boys, and majority of them are boys. Okay, there are some girls, but few and far in between. But this is increasing. Oh, the girls who are using drugs also, it is increasing. And we had a lot of HIV. HIV was fueled. It was in the 90s. Okay, HIV was fueled because of injecting drug use, sharing of equipments. And the government has put a blanket ban on sale of syringes over the counter. And as a consequence, they have no choice but to share the used syringe. And so through that, HIV in Nagaland was fueled by a blanket ban on the sale of syringes and sharing of dirty needles and syringes. And not only that, Hep C was also quite prevalent. And many of our clients who died, who recovered, who subsequently died, is from Hep C. HIV as well, but from Hep C as well, okay, because there was no treatment. In those days, the testing was, they had to pay so much money for testing. It was never free. And not only that, but also for excess drugs. You had to pay lakhs of money to get treatment. And who has that sort of money? Okay, especially a drug users community. Nobody has that sort of money. And so what had happened was we are so grateful to our recovering boys. I say boys because majority of them had recovered mainly from Kripa Foundation, including our outreach worker. And they had formed a network called Nagaland Users Network. All right. And they were able to go and talk to the drug company and say that many of us are infected and we need free drugs, subsidized drugs or free drugs. And so today in Nagaland, at least as far as I know in Kohima, that NHK provides free medications for Hep C. Okay, and but prior to accessing that, they have to make sure that the liver is functioning properly, the kidney is functioning properly, and the blood hemoglobin, WBC, and all the other blood parameters are normal. And so those they have to pay, and they have to pay about 1,500, round about that. Okay, and but they can access free medicines now. We are so grateful that our network has come up for the benefit of for our users community, as it were. But today, I'm very sorry. Our outreach, this health camp, I'm talking a lot about the drug scene as on a whole. But today, with the lockdown, there has been a lot of restrictions, right? A lot of restrictions as far as COVID were concerned, yeah? Lockdown, this restriction, that no gathering of people, social distancing, sanitization, and things like that. And we were also made to close down our facilities, as it were, because of the lockdown. Whilst all these restrictions were there was no restrictions on the flow of drugs into our state. Okay. I don't know how, but then, there has been a new brown sugar called sunflower. I'm sure you're aware of that. Sunflower. It is an adulterated form. And many of our users, they say that they have used soft drugs, okay? Soft drugs, but during the lockdown, they started using sunflower. All right. Not only chasing, that is the usual way of taking, but they started injecting. And so we realize now that injecting is on the rise. And I'm sure you see in the paper that people, scrupulous people are bringing brown sugar. And recently on the 3rd of June, it was in the paper that 253 grams of brown sugar was brought by 2 individuals in their own vehicle, So for them, profit, making money at the cost of the lives of our users, right? The lives of our people. And because there is demand, they are bringing it at the risk of their own lives. You understand that? Okay. And what is very worrying is that there is an increase of sunflower availability, of brown sugar coming in. And not only that, but injection. People are starting to inject. It'll be the same scenario like that of 90s. When HIV was on the rise, when Hep B, Hep C was on the rise, and STD was also on the rise. Okay. And so we are very worried. And so hopefully that through 26 June, which is the World Drug Day, the International Day Against Drug Abuse and Illicit Trafficking, that more talks, more awareness will be created, and that people will know that, watch out, but do not discriminate our users, because stigma and discrimination doesn't do anything for them. Instead of helping them, they make them go underground. And so our services, which are open and available, they cannot access our service. And when they go under hiding, that's when the diseases, as well as the disease of the addiction, also spreads. And some of them, we have had people who died of overdose, right? And those were few and far in between. But now it is on the rise again, right? So that is what is happening. And drug addiction is a seesaw, right? Recovery and relapse, recovery and relapse. It is a step ladder sort of thing. And so they may be doing really excellently well when they are in recovery. But then something triggers and they relapse. It doesn't mean that because they have relapsed, it doesn't mean that they are bad people, right? But it is a fact of life, right? Fact of life. And so that's what it is. That's what I want to share. And as I said, this free health camp is to create an enabling environment for our users as well as for their families. If they have any problem, then they could come and access the services that our UPSC has brought. And not only that, but then they'll become familiar with us. They'll feel free to drop in at any time. But this is not only entirely for our drug users community, but also for the general community as well. They are invited to come and access this service. And so this is a wonderful time, and so good that you can come and be a part of our free health camp on the 18th of June. Thank you.
Hello, my name is Ilato Kiba. I'm recovering addict. Movie to the time that expect that one day movie din dole the drug addict ko expect karana family am expect karana. To the time that movie kitab pore tam de dole the balwa pore thagela time thagise. Kintu aste aste sati hana de milegine. तो मैं छोटो दम देवरा वाले भी मिले साथी अंदर मैं बड़ा एज टावर खाना दे मिले ला था किसी तो एज टावर खाना दे मिले तो लो तो बिया से तो नहीं किंतु मैं कंपनी बिया फाने ला चूज करी तो इन्हें करने out of curiosity था किसी try करो मन मन खान खा दिखने मैं भी try करो मन तो एक टा enjoy करो मन तो इन्हें करने मोटा मन हो जाए कोने try करी तो try करने खा तो लो तो मचा लगा शुरू से तो ना जाने इन्हें फट एडिक्ट हो जाए dependent हो जाए तो dependent हो जाता है तो पीछे तो आस्ते आस्ते ना खाइले तो withdrawal face करे ना खाइले पीछे दुख पाए गाउट joints खान सब बेकाए एकदम restless हो जाए इन्हें था इसे तो मुझे addiction support करो ले निम्ते तो मुझे तो खावले शुरू हुआ पीछे मुझे behaviors खान मुझे character खामी पीछे बिया हो जाए किले तो मिसा खावले शुरू से जो global शुरू से मुझे addiction support को बोले निम्ते तो every time family वाला आते पैसा तो ले तो मांगी बोलना पड़े तो मुझे addiction support को बोले निम्ते तो मुझे life थी किताबी expect ना करे याकन किताबी ना बाबे याकन सब global शुरू से और कोवले तो बिशी ऐसे लोग मुझे खाता वाला कोई दिवो तो इन्हें करने मुझे jail खान देवी जाला शुरू से jail देवी मुझे बिशी बार जाए से इन्हें करने extortion ला केस खान देवी फांसी से मुझे ना तो इन्हें करने गुली खाला टाइम भी था किसी मुझे मारे दिया ला किंतु thank God मैं इतने भी survive करने का तो during my addiction days भी मैं आराम बड़ा खाने बिराला था क्या ना बेसिक दुख बड़ा था क्या ला था इसे मुला मन दे भी छारिवा इन्हें मन तो था क्या लेकिन overcome करना पड़े इतने टाइम दे तो महान पिला खाला टाइम दे तो आजकल निचना इन्हें NGOs खान किबा था क्या ना outreach worker खान इन्हें social worker खान आइने home visit कराए इन्हें खान था क्या ना rehab भी ना होने ला था किसी मुझे तो detox एक ता नागा हॉस्पिटल था गया तो जाने था गया तो किधर बा जब detox ते जाने ट्रीटमेंट करवा ओला वो भी खाई जाए इन्हें था किसी तो इन्हें addiction टाइम ते भी बिशी दुख करे ला फेस करे था किसी किंतु आस्ते आस्ते कुम्भा साथी वाला इंट्रोड्यूस करने rehab ला दे मुझे इंट्रोड्यूस करे तो rehab ते आई ने ट्रीटमेंट बिशी तो rehab ते ट्रीटमेंट ला बिशी तो मुझे ताता वाला बिशी सिक्योर पड़े से किले वाले rehab ते जाला लाभ एक ता तो ऐसे कि हम यहाँ बाहर वाला छारे वाले तो बिशी मानो ट्राई करो पड़े थे तो छारी दिए वाले भी और किले खाई जाए किले रिलैप्स हो जाए इतो एक ता प्रॉब्लम है दो एक ता से किंतु rehab ते जैसे वाले तो तादे मैं निज़र ला पर्सनल एक्सपीरियंस वाला तो मैं जाने वो पड़ा तो तादे जाइले तो हम यहाँ डेली क्लासेस कान था क्या तो क्लास ते सिखाई कि हम यहाँ एडिक्शन तो किया से और बाहर दे वाला बिशी दे भी खावले मन टाइम दे वाले भी आर्ट्स कान कर्विंग कान ऐसे के लिए भी किन्हीं ओवरकम करो लगे family halada relationship kinya build kuro lage society de kinya mano lade aro rebuild kuro lage relationship kan dole so to on sab sikai nya kare rehab to rehab pora bishi learn krise to nya kare rehab pora learn karne hola nya movie recovery thagya to nya karne ami ala director abu Kripa la director tagibe bishi things ajai ki tai to platform to moge te moge te as an outreach worker kam kuro dia se to mo aji te kam gra dole moi मुला साथी भाई खान इधर कौन सफर करे जब दवाई खा हला तो हंगे जाइने मोटिवेट करे और तो हंगे ट्रीटमेंट दे लो जाए रिहैब दे लो जाए कुम्बा की तो प्रेयर सेंटर दे भी लो जाए लाभी करे से और कुम्बा दो ले इंडिया सिचुएशन कंडीशन पर भी कंपेल कर दिया कि treatment center punchon na parela to iniga devi moi home detox karide to home detox mane to moi personally gorde jabo ta hange jaine counselling dibo daily jabo counselling dibo aro dawai dibo morning je dawai dibo aro sam dibi jawole lagile aro jabo aro kini ase tibi sabole follow up inia bi jai thege to inia gone tahan choijon do ita home detox kari na ase moi hat prabi to ita tok to le to tahan ni som हमरा सब भाली थगी আছে तान choijon bitor le to এটা আইনি মই একটা মেসেজ দিবলে মন থাইগা দলে তো সাবে এটা তো কবলে আমি আলা সোসাইটিতে আমি মানুয়ান অ্যাওয়ারনেস না নাই হলিবে আমি আউটরিচ ফোকাস আছে ফিল্ডে যাই থাকে এভরি কলোনি এভরি কিনারে যাই থাকে এভরি কলোনি এভরি হাউসহোল্ডে একটা এডিক্ট থাকে নিছিনা হয়ে একটা যে হলিতে একটা ফ্যামিলিতে একটা এডিক্ট থাকে নিছিনা ইনিয়া হইছে তো উতিবি মই জাইনে লোক করে আন্দ এজ দলে আর বেশি দলে 19 to 23 hange bishi lok kore to india kone to anlade jaine kam kori thai ase to hange jaine motivate kore ase to recently aru lok kore do aru to an barabi es bishi choto labi lok kore labi thai ase to india kone olop din age dibi ekjon metric দিয়ে thai to taila metric dela rukhine tai ge rehab delo ja tibi krise to beshi ase eta man society I mean mala machode edik khan beshi ase olibi parents can award again and nine ajane dobra ekta do parents kan ge bi common thaiga dol kuma parents dol do bacha ange bishi luka labi kore tan la nijor la repetition bian hawole tan la image bian hawole nimde bacha ange cover kore de labi bishi dikhai ale actually bacha ange cover kriya bacha ange support kore ne nya lukai dia dol baba amai ta khan la bacha ge hat dhurine graveyard te punchai dia la je to na so boy baba ma hangibi parents hangibi ko mala jiti bacha khani niya ke ba thai se help seek ko early help seek krise gole treatment dai ho paribo treatment dai se recovery dai se gole to taila life to le setup ho jabo paribo kintu inia lukai thai la tok to le do bacha de kitabi bhal na bo aro bishi bia bi ho jabo aro aji gale to bishi parents kam to dikhya dole to otibi ase ki bacha ange dole to কি লাগি আছে মোবাইল হবি ল্যাপটপ হবি কি আজিকালি তো টেকনোলজিতে বেশি আছে তান খেলিবলে লা সামান খান বেশি তো কি লাগি আছে পয়সা হলে বি সব দি দিয়া আছে গড়ে তো একটা কোয়ালিটি না দিয়া তাই খান না প্রেজেন্স তাখান লা টাইম দলে তাই খান লাভ তো বাঁচাকে না পুনছে তো একটা মই ফিল করে না তো কি হলে বি বাবা আমা বড়া বাচ্চাকে টাইম দিয়া আর না দিয়া লা বাচ্চা তো বেশি আল্লাহ হয়ে যায় না তো বাচ্চা খান বি বাবা আমা খান কিতা ঘর আইবো ইনিয়া অন্য রিখিও না পারে লং করে তান লাদে বইনে কথা করো মন জ্বালাবি থাকে তান লাদে শেয়ার করো মন থাকে আবি থাকে কিন্তু কুমা প্যারেন্টস দলে মই সব প্যারেন্টসকে কোয়াবি নহয় কিন্তু কুমা প্যারেন্টস তো ইনগাবি থাকে কি বাচ্চাকে অলপ টাইম বি না দিয়ে তালা প্রবলেম কি আছে তুই আন্ডারস্ট্যান্ড করলে বি না করে না আর না ভাবি না তো ইনিয়া অনে বাচ্চা তো তাতে করাবি বেশি ফার্স্ট্রেট হয়ে জ্বালাবি হয়ে যায় কুমা তো আর মেন্টালিটি বি তাহলে মেন্টালিটি বি বেশি বিয়া করে দিয়ে না বাবা আমাদের মুখে মরম না করে ইনিয়া লাভি যায় না তো তাহলে টাইম না দেওয়া দলে তো তুমি বেশি বিয়া একটা হয়ে যায় তো রিকোয়েস্ট একটা আছে কি বাবা মা আনবি নিজের লা বাচ্চা আছে তো টাইম দিনে তাহান কিনিয়া যা আছে কি খাইছে কি খাওয়া নাই এইটো আমি জানিবলৈ করলে ভাল আর যদি এটা ইনিয়া তাইখান বিহেভিয়ার্স খান অলপ চেঞ্জেস খান দেখি আছে বলে খা লাঞ্চিনা অলপ কিবা সাসপেক্ট হোৱা আছে বলে দলে ফাট হেল্প সি করলে ভাল বাচ্চাকে ভালো কথা করবি ইনিয়া অনেক কিবা হয়েছে বলে তো আজিকালি দলে তো সোশ্যাল ওয়ার্কার খান বেশি আছে কাউন্সিলর খান বেশি আছে আইনা আমি আলা দিবে আহিব পারে আইনে হেল্প সি কৰিছে বলে তো আমি জাইনে মত কৰিব পারব জাইনে কথা কৰিব পারব আর তাই বি তাইলা ট্রিটমেন্ট কৰিব পারব রিকভারি আহিব পারব তো এইটো একটা খবর মন থাকে তো না সবকে আর এটা মান স্কুল খান দে কলেজ খান দেবি এটা বেশি যাবলে করে আছে লাস্ট 2 years back তো প্যান্ডেমিক খবর আমি আনকো এক্টিভিটিস করবলে পারে না কিলে হলে সোশ্যাল গ্যাদারিং পুরা বন্ধ করে থাকিছে তো এটা তো হলে তো খুলি দিছে তো তোমরা আমি স্কুল খান দেবি যাই না অ্যাওয়ারনেস খান প্রোগ্রাম খান করে শুরু আছে তো সোসাইটি আই মিন কলোনি খান দেবি যাই না করবলে করে আছে তো অ্যাওয়ারনেস তো বেশি লাগে এটা আমাদের এনে কলোনি ইয়ুথ খান কে বি সব কে বি রিকোয়েস্ট আছে কি আমি আনি নিয়া আনন্দে আমি আনকে বি সাপোর্ট করে নাই কি লদে মিলি কিনে কাম করলে বেশি ভালো হবে করে থ্যাংক ইউ মই দলে তো খাওয়া দলে মই বেশি মানুষ এক্সপেক্ট না করে লাইস পড়া 14-15 years ইন্ডিয়া বড়া খাওয়া শুরু হয়েছে মই না to ita moi age to 46 ase sai jole moi addiction life to moi half life to ni ta de spend jai jani sina hoise to moi recovery din bisi deri bito hane kintu itu bar moi recovery itu bar dole de sopara lamba jao pare ase thank god aro Kripa foundation ge bisi thanks aro moi ke to platform dine moi ki lebi itu Kripa wara ine itu treatment no pare se aro rehab para sab learn karo pare ine aje ki learn karo pare se to apply karine so aji moi itu recovery de thaga do moi enjoy moi experience para moi sati bai khang suffer karange be jaine tange motivate kara na moi experience kan share kare ta hange so inia kone tange motivate ko bole कोशिश कर जाएगा मैं
Kripa Foundation office there or outreach drop-in center ODIC laga office there hina se yede 1 day free medical camp julia se in collaboration with Urban Public Health Center Sekhazu tahan milaina yede aji free medical camp julia se to edu free medical camp to ki karne ase koshi bole to Kripa Foundation kan bi tahan man diri tahan free medical camp dibo kona and they are usually tahan kun ke tahan recovering drug addicts kan drug users kan tahan ge substance users kan alag la tahan ge counselling die tahan ge treatment dawai kan die ena kurina tahan kam kuri thaka pandemic karni tahan free medical camp do na kuriwo na parigina ajide man time phal olaina ahigina tahan edu free medical camp to kuria se ere high school junction de na kurina mohan idea hunishe Dr. Joyce logote Dr. Joyce Angami tai do idea president Nagaland medical council to ena kurina aru tai medical officers se na kurina tai mohangi inform bi kushe tahan mohan tai kotha pura do mohan jani paise kinaga Nagaland drug users kan 90s pra loigina ahigina man bacha khange mostly youngsters kan ena ahigina drug users man high de thagina aro itia laga present situation de shigule do brown sugar kiman ahia ase aro bacha khan school going bacha khan huishikule bi idu laga te ahigina thange tade use kuri thaga laga mohan jani pai ase to ena hoigina Dr. Joyce pra power explain kushe Kripa khan ki kure ase aro yade drop in center ODIC de tahan ki activity kila kam kure ase tahan mohan janai dishe and then mohan Ilato Kiba tai be recovering addict ekta ase tai kinaga tala youthful days tai 13-14 years pra study kura them devra tai pura them devra kinaga tala life to drugs use kurina ena kurina ahigina addiction de thagigina kinaga ida recovery de aishe holebi one regret ta lagabi ekta thagya dole do tala young days to hujule tai itu laga time di jejeshe edura tai ide hoshugulibi in tai ide mid 40s ti ase holebi tai Kripa Foundation ge agina associate kurigina tai ide outreach worker kurina nijila testimony tai lui jaigina young boys kan maiki kan hoishuguli bi ida do mota kan ekla addiction de nai lebe maiki kan bi asiguna man hunishe to tahan ki kinaga tala testimony share kurina kina encourage kurina tahan hoishuguli bi counselling hobi dawai kan ki avail kurubo lage kinaga edu addiction bra bahar de olawo lage edu kan tai colony de hoishuguli bi tala on area kan de hoishuguli bi tai edu kan kurigina ja asiguna man hunishe to tai kwa ilato kwa tai mohan hunya do shule to itia ajikali itia the technology world de hoje most of the mohan bacha kan dikhya ase gadgets kan ekta nole ekta thagigina tahan itulo de hi involve kuna thage holebi tahan bi manu ase tahan bi parents laga nole bi siblings kan la family kan la love to lage attention lage edu garni ilato kwa nishna ami khan mohan do as a human being mohan bi feeling thagya bra love and care ro lagia edo garni kiman hugina kiman gadgets kiman facility thagi shigulibi parents kan hobi family members kan holibi mohan bacha khange hole do bar attention bi diwo lage ena gona time dine attention bi diwo lage tahan la ki behavioral change ase edo han bi notice kuro study kuro lage gona edu bi mohan learn krisha ji to tahan logode interact kurigina mohan bujado hoishigule do drug addiction do hole do 90s preman high prevalent thagigina and edu drug addiction ahya do ena hoigina HIV prevalence bi pishi high ho jai Nagaland de ena ho pichi de phase wise dishna eta do hoishule do brown sugar sunflower ko alaga edu youngsters kan no de even school going students kan hobi higher secondary kan hobi konishna within that 18-19 years to 20 edu kan la beach kan de edu users kan pishi ase ko report hisab te do te do ra ami kan society de action bacha khan ite bra dahan itu chola suru hoishigule do in the tahan laga life te tahan ki hobo eku hobo na paribo because tahan la prime age te tahan laga abuse hui jabo edo garne action ke ami khan bi edu aware hobo lage family members kan bi tahan nijila bacha la behavioral change kina hoase edu bi janibo lage koina aji free health camp te ahina mohan edu jani paise to ami khan sob edu public khan ge bi aware korle mon thaka do ami khan action nijila khorde ki changes ahya se bacha khan ode bi kinaga hawa se edu mohan study kurbo lage guna ami khan edu so manuge janai dia se with video journalist Kevilele Mehta moi Lorini Changlao reporting for NLTV from Kohima.